Hello, I'm Dr. Richard Cole with NJSR, and today we're doing a transforaminal epidural injection. And the procedure is used to help people with herniated discs and nerve compression, which can lead to back and leg pain. And what I'd like to do is to use this plastic spine model to demonstrate some of the anatomy and some of the details of the condition and the treatment that we're going to use. This indicates the front of the spine. This indicates the back of the spine. These solid white structures represent the vertebral bodies, and these slightly yellow gelatinous entities represent the intervertebral discs. And on this spine model, you can see that the herniation is represented by this red protrusion, which is impinging upon the exiting nerve root, which lives in what we refer to as the neuroforaminal space. And the reason that people with herniated discs experience or can sometimes experience leg symptoms is because the herniation presses upon the nerve root, leading to complaints like pain, numbness, tingling, and even sometimes weakness of the leg. And what the transforaminal epidural injection allows us to do is to deposit medicine, an anti-inflammatory and some local anesthetic, into the neuroforaminal space. And we carry out this procedure with the use of fluoroscopic guidance, which assists in the safe and effective placement of the medicine. The procedure is commenced with the identification of the lumbar intervertebral levels. And we start by identifying the level of T12. This is T12, L1, L2, L3, L4, and this is the L4-5 interspace. And today we're going to be injecting medicine into the patient's L4-5 neuroforaminal space on the left-hand side. Picture? I'm going to ask the X-ray technician to tilt the C-arm to obtain what we refer to as an oblique view. How many degrees is that?
15.
Keep coming to 20, please. Stop there. We now have an oblique view of the neuroforaminal space, and I'm going to use this view to guide the needle into the correct position. Picture? 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 Okay, lateral, please. We're now going to turn the C-arm into a lateral view, and this is another fluoroscopic angle that allows me to advance the needle tip safely. Picture. Okay. As you can see on the X-ray monitor, the needle tip is now in the middle of the neuroforaminal space. This is where the herniation and the exiting nerve root are both located. I now take some X-ray material, we refer to this as IsoView, and I inject it through the needle into the space to identify the correct location of the epidural space and the exiting nerve root. Picture? And as you can see, the contrast is correctly moving in the epidural space and into the exiting nerve root. We confirm this with an AP view, which, as you can see on the monitor, has confirmed the correct placement of the epidural, of the needle, and the contrast. We then take a therapeutic solution, and this is injected through the needle into the neuroforaminal space. The needle is withdrawn, and this concludes the procedure.